My name is Dr. Jeffrey Klein. I'm a dermatologist in San Juan Capistrano and a clinical professor of dermatology at UCI. My specialty is clinical pharmacology. This is Ray. She's had very painful post-herpetic neuralgia for more than 10 months. That means extreme, long-lasting, chronic pain from shingles. She's seen many doctors. She had many treatments. None of them were of any benefit. For about 10 months, she had 9 to 10/10 pain that was debilitating. And she happened to find me, I found her, and we treated her with a new approach. And for the last 10 days, she's had 0 pain. So how was the treatment, Ray? Was it painful, the treatment?
No, not painful at all.
And the treatment involved injecting a fairly large volume of very dilute antiviral medications and local anesthesia. And it's a pretty unique situation. We've applied for patents for this. They're in the works, but we want people to know about the possibility of this treatment. We call it ZosterRx. It's a new formulation. The insurance companies don't know about it. The FDA doesn't know about it. We're applying to the FDA for a clinical trial, but it's new. We're not advocating it. We're just wanting people to know that it's out there and they might want to consider this. Ray, do you have any pain right now?
No pain right now. It's wonderful.
How are you sleeping?
Great.
Okay.
Before I wasn't. I was awake all the time.
Okay, that's good. Well, we don't know how long this is going to last. It's been 10 days now with no pain, and we hope it'll last a long time, but even if it only lasts several weeks, it's way better than nothing. So give me a call if you have any questions, and good luck to you. Thanks.
Thank you.
A little injection at the site where we're going to do the insertion of the cannula. This is a tiny, tiny needle. You should hardly feel it at all. Gently touch her. You want your face there. Do you feel that?
No.
No, good. It's a painless little tiny injection. This is a special subcutaneous catheter. We call it the sub-Q cath. And it is designed to be inserted painlessly through the skin. The local anesthesia comes out the tip as we're advancing it so that there's no pain as the needle goes through the tissue. And then once it's in place, we take this metal tube out, and it's left with a catheter that has holes all the way down. It's sort of like a garden sprinkler hose, and it distributes the local anesthetic throughout the tissues very efficiently and painlessly. Now to insert the catheter, the sub-Q cath, I'll show you the rate at which the fluid comes out. You can see, and it makes the tissue numb before this little needle gets through the skin. Right? So I'm advancing this here under the skin. And now we're going to start pumping gently. Tell me how you're doing, my dear.
I'm doing fine.
So it's all the way in. Now I'll stop. Take this tubing out like this. We're done. This part we dispose of. Fluid is being pumped through here. We hook it up to the catheter. And now I step on the starting pedal, and now we're pumping. Now we're delivering the local anesthetic. What do you feel?
Nothing.
Nothing? Okay, good. This is the bag of the tumescent acyclovir that we're infiltrating. This is about 1 liter, and we're going to be infiltrating about 200 or 300 cc's and milliliters into this area. It's a lot of fluid, but it spreads out very nicely, and that's part of the wonder and the surprising beneficial effects of this. It's very dilute, it's painless, and it stays where we put it for a long time. We've infiltrated about 300 milliliters in this area. As you can see that it's fairly firm, and it's spreading. This is actually firm way beyond the tip of the catheter. The catheter only comes to about here, but still there's firmness out here. So the fluid is spreading out and covering all the area. We're done with this area, so I'll take this out. And you can see there's the flexible catheter. And if I step on the pedal, you can see the fluid coming out, see? So now we're going to insert a catheter in the opposite direction to fill up this area here. It's in place, so I take this out, start the infiltration again. And there we go. Now the fluid's coming out, and it's making this nice and firm. Compared to this, this is soft, this is tumescent. This is empty now. We've infiltrated a whole liter under her skin, and it was painless. This is empty. It's now right here. Now we're going to take this out. We're all done. I think we're done. That was easy.
Very easy.
Okay.